Good morning, everybody. Thank you for joining us today. I guess it's noontime already for folks that are on the East Coast. My name is Dan Katz. It's my pleasure to share with you the lecture today on integration of ultrasound into medical simulation centers. Just by means of introduction, I am currently an attending physician of emergency medicine at Cedars-Sinai Medical Center in Los Angeles, and I'm an assistant professor at UCLA. In full disclosure, I am the Vice President of SonoSim, and although this is not meant to be any type of product pitch, clearly we will be referencing SonoSim during this presentation. We're going to be talking today about the integration of ultrasound into everything that has to do with simulation. And I think to do that, we really need to frame the reason for this conversation. So why are we talking about ultrasound today? Ultrasound has been touted recently as the new stethoscope, and the reason is it allows us to make clinical decisions at a patient's bedside in a more erudite fashion. We are more informed. It improves patient outcomes at the point of care. That's been shown not only for diagnostic purposes but for procedural type applications. Clearly an underutilized and cost-effective modalities. Everywhere I walk around our hospital, we see ultrasound machines on the wards and the ED that are unused. And as the technology is becoming more compact, of higher quality, and less expensive, we can envision a time not too far away where these devices will be fitting into our white pockets and will be easily accessible to clinicians of all type. So you have to think about how training in ultrasonography is currently provided, and most of it is done through these types of crash courses. And this picture is very telling. You can see here that we have a patient. It's a standardized patient. These are generally healthy individuals. He's listening to his iPad. He's got no acute medical condition going on right now. You have your ultrasound machine, you have your instructor, and then you have several students. And when you look at the students, one of them is holding the probe and the rest are kind of staring and observing. They're not actually getting any stick time. One of the common things that we hear about these courses is that although they're extremely high yield during the course, once they're over, the users have no opportunity to go back and practice their skills. They have no instructor that they can call on. And they haven't really been exposed to any pathology except for perhaps some videos that an instructor may have brought along with them. So current barriers to traditional ultrasound training include the availability of instructors, access to broad patient pathology in a standardized fashion, an adequate number of ultrasound machines to provide users enough stick time. And given these barriers and the difficulty in recreating that type of course environment that I just alluded to, simulation centers are being looked to for leadership ideas surrounding how to train folks at their respective institutions. This is coming from a New England Journal of Medicine article in 2011, and it references the selected applications for point-of-care ultrasonography according to medical specialty. And as you browse through this list, you can see that there are clinicians here of every type. Now, it's not just physicians that are going to be utilizing ultrasound. It includes nurses and other mid-level providers, midwives, paramedics, the military. And when you talk about the clinicians in practice that were not traditionally trained in ultrasonography, they need to be trained. Residency programs have multiple, they have needs for ultrasound training, and then medical schools are now also starting to integrate ultrasound into their curriculum. So this slide is probably the most important one of our presentation. It outlines our discussion for the next 20 or so minutes. The challenges for a simulation center include providing training to multiple stakeholders of different type of specialties and different training programs. This is coming at a time when the standards, expectations, and the breadth of ultrasound applications continues to expand. It seems like every day there's something new that ultrasound is being used for. This has to be done in a manner that maximizes efficiency and throughput through the simulation center while still tracking the user and learner performance. You have to assess the ultrasound competency. you have to really try to understand whether or not the user knows how to apply their knowledge into a clinical environment. So truly, how do they use ultrasound in the context of medical decision making when you place them in an immersive simulation environment? And finally, a question that keeps coming at us is, how can we help hospitals with their credentialing pathways? And the example that I'll use for this presentation is for central line placement. When we looked at all these problems, we decided to flip the classroom, because that environment of one-on-one teaching, me with a resident or a medical student, an ultrasound machine, and a patient, is simply not scalable. And when we consider all the different types of learners and their different specialties, it's impossible to replicate that kind of an environment in a standardized fashion when you consider all the different patient pathologies that you need and all the learners that are going to be coming through your doors in the Sim Center. So we're going to start with this first component, which is knowledge acquisition. What we did is we created self-directed, cloud-based didactic sessions. When you refer to the flipped classroom, you want students to pre-learn rather than spend all that precious time in front of a PowerPoint presentation. Rather than that, you'd like for them to do all the hands-on components. And when we organized the content, we did so broadly in terms of anatomy and physiology, core clinical applications, advanced clinical applications, and then ultrasound. So I'm actually going to switch screens over here real quick and just take you through this self-learning session. This here is the SonoSim course library, and you can see that as I scroll down here, there are didactic sessions, all cloud-based, accessible from any computer or even an iPad. And they are basically from head to toe. Some are labeled anatomy and physiology, some are the core clinical applications, and some pertain to advanced clinical applications. There's also an entire section on ultrasound-guided procedures. We always start novice users through the fundamentals of ultrasound section, where they're introduced to transducer basics, ultrasound machine basics, imaging modes, etc. Just to give a quick overview of what one of these sessions looks like. Again, they are narrated, evidence-based, peer-reviewed. You can see that we begin here with an introduction. We quickly move into pathology in this core clinical module. And at the end of each one of these modules, there's a mastery test. This is a 20-point scored examination, and that is being tracked in cloud as well. Okay, so the didactic sessions provide the users with the fundamental knowledge that they need to gain in order to hold the transducer in their hand and begin scanning. So next we move on to the skills proficiency. And that's where simulation can really play a significant role. Again, if you consider the fact that you would need, let's say just for a cardiac session, a patient with a cardiomyopathy or perhaps right heart strain in the case of a pulmonary embolism, or a pericardial effusion if you're wanting to teach tamponade. You would need those 3 patients just for those 3 applications, enough machines for all the students that you have that are cycling through. You need to repeat that session over and over again, and that's just not possible. So what we have done is we have pre-scanned the pathology and we placed it into the simulator, again in a self-directed fashion. The simulator is augmented by the same types of modes that you would find in a traditional ultrasound machine, so continuous wave Doppler, power wave Doppler, continuous flow Doppler, and then specialty-specific measurements and formula worksheets are included as well. And importantly, everything again is being archived in the cloud. So I'll toggle back over here. And this is what the interface looks like. I'm actually going to pause here just for 1 second. For those who have never seen this product, you might get, let's say, a nurse who wants to learn how to insert a peripheral IV under ultrasound, who has never been introduced to the concept of ultrasonography. What we do is we actually start users off with a very basic cognitive task trainer. This is the corollary to the fundamental And in this case, we're not starting them off with complex human anatomy. We're starting them off with something very basic in this box. And as they scan through it, they're trying to decipher what it is that they're seeing. If I click here on this button called Layers, you can see that we're actually scanning through a cone, and that object that seems to go from a small circle to a large circle in one imaging plane and seems tapered in another imaging plane is clearly visualized here as this cone. Again, just to be clear, I'm sitting on my personal computer over here. I'll manipulate the probe. The image here is changing in real time. But what we really sought to do is try to recreate that course environment, again, in a self-directed ultrasound training program. The elements of your traditional course include a patient, an ultrasound machine, an instructor, and the student. That's me at this point. At any point, if I need my instructor, I can click here on the Findings button, and a virtual instructor will come on to explain to me what it is that I should be seeing.
We're evaluating the heart of this 23-year-old male who recently suffered from a viral illness and now presents with decreased exercise tolerance, weakness, and dyspnea on exertion.
So that's my instructor. I can call him at any time and get an explanation of what it is that I should be seeing. You see that the probe on occasion turns green. When I'm scanning with a resident or medical student, if they're stuck and they can't find a window, I can help them. Here what we can do is we can virtually hold the student's hand. So for example, if I'm trying to find here the right ventricular inflow tract, that phantom probe appears over there, and if I line it up, there it is. That's exactly what I want the student to see. You have your traditional modes and buttonology here on the screen, so we can adjust the depth, we can adjust the gain, we can bring on certain Doppler modes if we wanted to do that. So in this case, let's bring on the M mode, or if we wanted to show continuous wave Doppler, color flow Doppler, those things are available. But where I got into this is that we wanted to do some kind of a proficiency assessment for the students. So why don't we give everybody a task over here. Let's go into our, let's say, internal medicine residency programs and ask our students to get a measurement of the gallbladder wall thickness of this patient who could come in with some abdominal pain. So clearly we're seeing some pathology over here. There are gallstones, there's shadowing, there's pericholecystic fluid, and there's gallbladder wall thickening. So as a student, I have a unique law. I'm going to optimize my image for my instructor, click freeze, bring on my calipers, and perform a measurement. I'm actually making an error. I'm measuring the posterior wall instead of the anterior wall, and I'm doing so on a long axis rather than a transverse orientation. So I'll write gallbladder wall thickness is 6.6 millimeters, and when I save this, this is actually going up into the cloud, and I'll show you in a second where that lives. The instructor can then go back on their own time and then review all of the students' saved images with their interpretations. There are numerous other features in here that are provided to the learners as they're learning ultrasound, and all of them are really meant to help them decipher these complex ultrasound images that they're seeing. This is one type of augmentation that we do where we show a CT scan or MR image side by side with an ultrasound image in your non-conventional imaging planes. And if you look just at this ultrasound image, you may wonder why this is all dark. You can clearly correlate that to the bowel that's seen over here. We also have a button that allows you to visualize the three-dimensional anatomy, the layers button. Just like we saw inside the box, we can see anywhere inside the human body and follow the trajectory of our ultrasound beam as it transects the underlying anatomy. Okay. Let's go back real quick to the presentation. So that's a little bit about the skills proficiency. Again, you have the user go through a didactic session. That was tracked in the cloud. You had them complete hands-on training session with archiving of their images. The way this can be accessed is in a couple of ways. One is through a sim center solution where users would come to the simulation center and perform hands-on training in groups. Again, still in a self-directed fashion. You don't need to have a simulation technologist over them. The other way that we provide this is in a program that installs on the user's personal computers, Mac or PC. The entire program is downloaded onto the computer. You as the instructor or administrator can still assign them the content and the various tasks that they are to perform. So the next component includes the tracking of the progress and the user performance. And to do that, we really needed to create a robust archiving system for the didactics, for those knowledge assessment questions that are presented at the end of each one of these didactic sessions, for the archived images with their interpretations. And we needed to do so in a way that would allow multiple course directors to access that data, and in a way that in the end would yield an e-portfolio for each one of those end users. We did that through the introduction of something called SonoSim Performance Tracker. Again, a very robust analytics system. Here we're looking at an individual user. His name is Bryce, and we can see all the courses that were assigned to him. As we hover over a particular area, we can see how much of the course he's completed, how well he's done on an examination, the saved and archived images as well. So do you remember when I was performing that measurement of the gallbladder wall thickness? Here you can see a demonstration again of somebody saving an image, archiving the interpretation, and when it's saved, it's going up into the cloud. And there it is. There's the interpretation. Here we can look at the entire classroom as well. So again, you can either look at an entire classroom or drill down on an individual user. You can manage the accounts. You can export data sets and files into the entire learning management system. When we think about assessment of competency, we also think about observational assessment. And again, simulation can be very effective for rarely encountered pathologic conditions. That patient with a rupturing AAA or the woman who's presenting with vaginal bleeding and a rupturing ectopic pregnancy, those cases are difficult to come by, especially when you want to present them to multiple learners. And so simulation can help learners understand how to apply the ultrasound findings towards medical decision making. And what we're seeing here is that educators, particularly in the simulation world, are becoming more sophisticated. There's the concept of gamification of ultrasound education that we're seeing, and I'll briefly touch upon how this could be used for the OSCEs as well. This is a picture that I took a couple of years ago at the Ultrasound World Cup in Portland, and you can see on stage two standardized patients with a technology that we call SonoSim Live Scan. Basically, we transformed each one of them into 20 different patients with a variety of pathologies, and the game over here was a contest where the individual scanners would have to identify the pathology, buzz in, and an explanation of what it was that they were seeing. This is how it's being used in the context of an immersive simulation. And again, in order to accomplish this, we had to create a tool that would allow simulation specialists and educators to create cases that would match their educational and testing objectives. Now we're leveraging a technology called Live Scan, and Live Scan basically allows you to pair the SonoSim platform with SonoSim tags that are placed on either a standardized patient or a mannequin. And when the probe makes contact with those tags, it loads the appropriate data sets that you've programmed. Case Builder is the way you write those cases. And when we started this, we started with 5 different templates that include cardiac resuscitation, critical care, early and late pregnancy, trauma care, or you can create your own customized view. The template pulls up and you can select, in this case, the proximal IVC point was selected. You can scroll down through an entire library of all of our data sets for the proximal IVC, and once you find the one that you like, you'll click down there on the right-hand side, apply, and populate that data set. You'll continue to do that until the entire template is populated, write your case history, and then that gets imported into the simulator into a tab called SonoSim Case Builder. you can see over here. So there you see the technology integrated onto a mannequin. And again, it can be done on a standardized patient as well. Now, we're kind of going through a continuum over here. We started with the knowledge acquisition phase through the didactic sessions. We moved on to the skills proficiency through the self-directed hands-on training, and then through some of the observational assessment that we saw using the live scan technology. I did mention and forgot to comment about OSCEs, but we are seeing some of the medical schools integrating the ultrasound components onto standardized patients who are acting out a clinical scenario. The ultrasound machine is available for use on that standardized patient in the form of the SonoSim live scan technology. And for students who are astute enough to use it, they can apply that knowledge to the clinical scenario that's presented and can be tested on their medical decision-making skills. Last year, we introduced at IMSH the Laerdal SonoSim ultrasound solution. And that's where you continue through the circle of learning truly into medical decision-making and to simulation in teams. The Laerdal SonoSim product has 50 different scenarios, and again, they are organized in terms of critical care, trauma, cardiac resuscitation, early and late pregnancy. The cases are quite challenging, but they do provide commonly encountered clinical cases where the correct application of ultrasound acts as a pivot to facilitate timely medical intervention and decision-making in a risk-free environment. There are 3 different learner modes that are included. The first one is the individual learner. And here, you only need to have 1 leap operator. So it's a huge time savings in terms of efficiency for the sim center. The educator, the program director doesn't actually need to be there by themselves. And here you see that taking place. 1 learner with 1 leap instructor. This leverages the closed-loop communications that we've programmed in with automated responses, and it facilitates a rapid successive simulation of large groups of learners without the need of an on-site educator. This team mode that you're seeing over here examines the dynamics of the medical team in true clinical environment. It allows us to assess the communication both between the learner and the patient, the learner and the learner, and the learner and the facilitator. And the final mode that is provided through this product allows for customized scenario design. It disables the pre-programmed scenarios and allows the simulation technologist to leverage the data sets within SonoSim around a case that they've created. An important component which we shouldn't leave out includes the evidence-based materials and extensive reference citations that come along with these cases. They are provided for phase-specific essential events, for case considerations, and for the session review. And then finally, once we have our acquisition, we can hopefully go back and practice our care with a patient. But if ever somebody needs refresher training, whereas our traditional courses, you don't have access to the instructor, you don't have access to those patients or the curriculum, being that SonoSim is a self-directed program, it does allow for spaced learning and for refresher training. One of the questions that came up in the build-up to this presentation was the process of credentialing. And so I wanted to just show one application for that purpose. A few years back at our hospital, there was a directive that came down that all lines that were non-emergent should be placed under ultrasound guidance. And to do that, we needed to create a training pathway. This is a pathway that is quite agnostic to any institution and quite easily implemented. In this case, the learners would each have their own user account to SonoSim. They would have to access a course on ultrasound-guided internal jugular vein cannulation. You can see that the content that's covered here includes the regional anatomy, sonographic anatomy, procedure preparation, procedure steps, imaging adjuncts, technical tips and pitfalls, complications, and then it's followed by a test that again is cataloged so that you can document that those users have completed that didactic session. Importantly, they're also earning continuing medical education credits for these didactic sessions if they are not within a training program. Next, they can access the Sonos simulator to do the self-directed hands-on training. In this case, in this right upper corner, you're seeing the IJ being cannulated within the simulator. They can then come to your sim center and then using a real ultrasound machine, and you can see here just a gel pad, they could practice cannulating either a vessel that you've created, or perhaps you're using some out-of-the-box manufactured gel pads. But again, they're still within the simulation space. And then they can move to the ICU or their clinical setting and place that line under the supervision of somebody who has been deemed qualified and has already been credentialed. Again, if any refresher training is needed, they can continue those steps once more. So we started off with this, and I do want to tie loose ends up over here. Providing training to multiple stakeholders of different specialties and different training programs is challenging. The content that's provided within the program seeks to address all user types. We have, again, anatomy and physiology content for the first and second year medical students. There are advanced clinical modules for OBGYN that are worthy of any OBGYN residency program or physician who's currently in practice and needs to brush up. The breadth of content continues to expand. I think you can count on us to continue producing very high quality modules that pertain to this. Some of the things that are expected to come out in the near future include several additional OBGYN modules, some pediatric content pertaining to regional anesthesia. So we are following the trends in medicine, and we are keeping up with the times. We talked about the difficulty in terms of your traditional way of training, organizing a course where you have instructors, ultrasound machines, standardized patients. That's just not time efficient. So what we seek to do here is, again, flip the classroom, provide a self-directed program, and then it can be augmented with real hands-on training where the users come prepared and make the best use of that time with the instructor, with the patient, and with the real ultrasound machine. In terms of assessing ultrasound competency, we have provided for that through the performance tracker, through the didactic sessions that are tracked, test scores that are cataloged, the image archiving system that we've created. I'll touch about that, speak more about that in just one more second. As far as the medical decision-making skills when ultrasound is being implemented, you can leverage the live scan technology that we've created to use SonoSim either with a standardized patient or with a mannequin. You can build your cases around specific educational objectives. Or you can leverage the Laerdal SonoSim ultrasound solution where you have the 50 prepackaged scenarios that allow multiple different learner modes and are really quite efficient for individual training or for team-based training. Finally, we talked about the difficulty in terms of credentialing pathways, and hopefully that central line example was of use to you. Here at SonoSim, we are seeking to raise the bar every year, so some really neat things that are going to be coming up at around the time of IMSH. I don't want to take too much of the presentation time up with this, but please expect some pretty neat needle-based simulation from us as we seek to expand the e-portfolio created for each student. We would like to also allow students and practitioners to capture real ultrasound images in addition to their simulated images. And then finally, we are currently in the midst of prospectively validating performance assessment metrics and building them into the simulator so that could maximize the efficiency of those instructors who are tasked with reviewing those images that the students have saved. Hopefully that can be automated to some degree through this platform. I want to thank you all very, very much for joining us. If anybody has any questions, you can feel free to email us at info@sonosim.com. And I will field a couple of questions that are coming in right now. The first question was, how much content has been developed for nursing? The answer is a ton. We have content that pertains to the fundamentals of ultrasound, moving on to specific applications for nurses in a variety of clinical care arenas. So that could include, for example, DVT screening. It could include how to check for bladder volume before placing a Foley catheter, especially where hospitals are seeking to decrease catheter-acquired urinary tract infections. There are modules pertaining to peripheral IV insertion, to central line insertion for some of the more advanced practice nurses. So again, there's content here that is meant to be tailored for any type of learner, given different specialties and different backgrounds of training. We're going to take a few more questions over here. Excuse me one second. So we have medical students rotating with us 4 weeks at a time, sometimes from an outside state. Can we reuse an account for them? The answer is yes. We actually don't delete. We encourage institutions not to delete user data. So it basically goes into an archiving mode. And if that ever needs to be printed up for the medical student, it can easily be done. Again, the goal for medical schools is when the students graduate, they have an e-portfolio that has cataloged all of their coursework. This past year has been tremendous for us in terms of the integration into medical schools. In their case, it's particularly challenging. Some of the schools that we work with have greater than 1,000 students in their student body, and so the traditional way of training is nearly impossible from a logistics point of view. Moving towards a self-directed program has really alleviated some of the stress on the course directors. Importantly, it can also be used to train the trainers. So, for example, your anatomists that have never been trained in ultrasound can use the system to train themselves and then to teach the medical students. We all know that the 3rd and 4th year students who are tech savvy and eager might be outdoing the clinician who's been in practice for 20, 30 years, an amazing diagnostician and healthcare providers has not dabbled very much in ultrasound. This is a means for that clinician to train and get up to speed with the students that are going to be rotating with them. I'm continuing through the questions over here. Can you use the individual probe with this? The question I don't quite understand, but what I think it's relating to is whether the SonoSim personal solutions can be used to in conjunction with the live scan technology, and the answer is no. The SonoSim personal solutions, which is the program that installs on a personal computer, is meant for self-directed learning. We really couldn't imagine a case use where a student would begin placing the live scan tags either on a fellow student or a teddy bear or some other mannequin on their own time. Rather, that live scan technology is generally utilized in a simulation center environment, and again, the students can get their hands-on training through the self-directed program. An analogy that I like to use is one for CPR training. You expect your students to study those cards for the codes before they come into the simulation center to run a code with you. And so again, in an analogous fashion, you should be using the SonoSim ultrasound training solution on your own for self-directed learning. You would come to the sim center to run through a scenario via live scan or via the Laerdal SonoSim ultrasound solution. We had a question about whether this presentation will be archived for access by faculty. The answer is yes, and we can send all of you a link to that so that you can share it with faculty. And same question, can this be emailed? The answer is yes. Do we provide any courses? The answer is yes. This is an entire self-directed course. We don't actually run courses because of all of the issues that I just was talking about during this presentation. In general, courses are time-consuming, require a lot of logistical planning, ultrasound machines, patients, etc. The idea behind SonoSim is that users would study on their own time in a self-directed fashion. They could then enter any type of course that you provide with hands-on training, which I think this is an adjunct, not a replacement for real ultrasound scanning. But they would enter that with some pre-learning. They would leverage SonoSim for learning on the back end as well. Another question that came up, are there any certifications that take hours and training with the simulator? We do provide continuing medical education credits. These CME credits are AMA Category 1 credits, and they vary for anywhere between 2.5 and 4 units per module. Okay, I think that just about rounds up all the questions that we're getting over here. Again, we will make this available to you to share with other faculty and other Sim Center directors that be interested, that you think would be interested in this. Please feel free to email the link and share this information with them. I look